Have you ever dismissed a persistent itch as just a minor irritation? What if I told you that this seemingly innocent sensation could actually be your body's desperate attempt to alert you to something far more serious? In today's discussion, we're going to explore the hidden messages behind persistent itching in 3 specific areas of your body that should never be ignored. These warning signs could potentially indicate serious conditions like diabetes, liver disease, or even breast cancer. Understanding these signals might be crucial for early detection, prompt treatment, and ultimately extending your life expectancy. This information could literally save your life, so I encourage you to stay with me until the end. You'll discover how to interpret your body's subtle warnings and take proactive steps to safeguard your health. After all, your well-being is invaluable, and recognizing these signals early could make all the difference. Let's begin this important journey together. If you're not already subscribed, I recommend hitting that subscribe button and turning on notifications so you don't miss any potentially life-saving information. Your support means everything to me, and if you find value in this content, please help spread awareness by liking and sharing. If you enjoy this topic, comment with a 1. If not, a 0 will help me understand how to better serve you with future content. 1. Itchy extremities, the hidden danger signal. Have you ever experienced that maddening itch in your hands or feet that just won't go away no matter how much you scratch? Most people dismiss this as nothing more than dry skin or a harmless allergic reaction. But what if this persistent sensation is actually your body frantically trying to communicate something much more serious? When itching in your hands and feet has no obvious cause and persists despite your best efforts to relieve it, it could be signaling an underlying health condition that demands immediate attention. One of the most surprising culprits behind this symptom is diabetes, a condition affecting millions worldwide, often silently and without their knowledge. When your blood glucose levels spiral out of control, it leads to widespread dehydration, causing excessive dryness in your skin. But that's just the beginning. Elevated blood sugar also compromises circulation to your extremities, meaning your hands and feet receive inadequate blood flow. This combination creates ideal conditions for that relentless itching sensation you can't seem to escape. What's happening beneath the surface is even more concerning. Nerve damage, medically known as diabetic neuropathy. Imagine your nervous system malfunctioning, sending constant itch signals to your brain. You scratch desperately seeking relief, only to damage your skin further. For someone with diabetes, this creates a dangerous situation where wounds heal poorly and infections develop rapidly, potentially leading to serious complications like ulcers or, in extreme cases, even amputation, all stemming from what appeared to be just an itch. But diabetes isn't the only serious condition that might manifest as itchy extremities. Another potential culprit is primary biliary cholangitis, a liver disease that many aren't familiar with but should take very seriously. In its early stages, one of the primary symptoms is intense itching, particularly in the palms and soles, often worsening at night when you're trying to rest. This condition damages the bile ducts in your liver, causing bile buildup and progressive liver deterioration. It's a slow, insidious disease with potentially devastating consequences if left untreated, and that persistent itch might be your earliest warning sign. Can you imagine thinking you're just dealing with dry skin while your liver is actually in serious trouble? As the condition progresses, you might notice additional symptoms like overwhelming fatigue, unusually dark urine, and dryness in your eyes and mouth. These seemingly unrelated symptoms collectively point to a serious issue requiring immediate medical intervention. Without proper treatment, primary biliary cholangitis can advance to complete liver failure, a life-threatening situation that your body had been trying to warn you about through that persistent itching. It's truly alarming to consider that something as ordinary as itchy hands and feet could be connected to such significant health concerns. Yet this is precisely how your body communicates, through signals that are easy to overlook or dismiss. Many people endure weeks, months, or even years of chronic itching without realizing it could be their body's desperate attempt to alert them to serious conditions like diabetes or liver disease. These aren't conditions to take lightly or ignore. The sooner you recognize these warning signs, the better your chances of managing the underlying issue before irreversible damage occurs. If you're still with me and finding this information valuable, please comment 1 below to let me know you're engaged and benefiting from this discussion. So what should you do if you're experiencing persistent itching in your hands and feet? First and foremost, don't ignore it. Pay close attention to how long the itching persists and whether it's accompanied by other symptoms like unusual fatigue, skin changes, or digestive issues. If the itching continues without any clear explanation such as allergies or known skin conditions, it's time to consult a healthcare professional. Your doctor can perform tests to determine if something more serious is happening, whether it's elevated blood sugar suggesting diabetes or abnormal liver function indicating cholangitis or other liver conditions. Remember, these itchy sensations aren't just annoying distractions. They could be your body's urgent plea for help, signaling that something is seriously wrong. By paying attention to these early warning signs, you might catch serious health conditions before they cause irreparable harm. Think of your body as a sophisticated communication system constantly sending you messages. Every persistent itch could be a key to understanding what's happening beneath the surface. Don't wait until your symptoms worsen or until more serious complications develop. Be proactive about your health. If these warning signs are appearing, take the initiative to investigate further. Your life could literally depend on it. 2. Itchy eyes, your liver's desperate plea. Have you ever experienced that maddening itch in your eyes that just won't subside? Most of us have dealt with itchy eyes at some point and typically attribute it to environmental factors, perhaps dust particles, a mild infection, or seasonal allergies. But what if that persistent, unexplained eye irritation is actually your liver crying out for help? Few people realize that chronic itchy eyes without an obvious cause could be directly linked to serious liver dysfunction, particularly cirrhosis, a condition where your liver's ability to function becomes severely compromised. This vital organ works tirelessly behind the scenes, detoxifying your body, filtering harmful substances, and processing bile pigments. When your liver becomes overwhelmed or damaged, it can no longer perform these essential functions effectively. As a result, toxins and bile compounds that should be processed by your liver begin accumulating in your bloodstream. Eventually, these substances reach the delicate capillaries in your eyes, irritating the sensitive nerve endings and triggering that unbearable itching sensation you can't seem to escape. Imagine your liver as a dedicated worker, constantly purifying your system and maintaining your health. When this hard-working organ becomes overburdened and struggles to keep pace with demands, your body begins displaying distress signals, and your eyes are often among the first places where these warning signs appear. That seemingly innocent itch isn't merely an eye problem. It's your liver's desperate attempt to communicate that something is seriously wrong and it's struggling to function properly. In this context, itchy eyes aren't simply a reaction to environmental factors or dryness. They represent a warning that your liver is overwhelmed by toxins it cannot effectively eliminate. This is your body's way of signaling that your liver's detoxification process is failing, and the itching sensation is one of the earliest indications that something serious is happening internally. It's as if your body is urgently trying to tell you, pay attention, your liver needs immediate help. According to traditional Eastern medicine, there's a profound connection between liver health and eye function. Ancient healing traditions recognize that the liver opens into the eyes, meaning your eye condition directly reflects your liver's health status. When your liver is compromised or under stress, it manifests in your eyes through symptoms like chronic dryness, unusual fatigue, excessive discharge, and persistent itching. It's fascinating to consider that your eyes essentially mirror your liver's condition. When your eyes feel off, it might be time to consider your liver health rather than just treating the eye symptoms. But this connection extends far beyond just eye irritation. When your liver becomes overloaded, it initiates a chain reaction throughout your entire body. Imagine toxins steadily accumulating because your liver, your body's primary detoxification center, can't keep pace. This buildup can trigger numerous health problems, many beginning with seemingly minor symptoms like itchy eyes. These subtle signs often represent your body's initial attempts to get your attention before more serious damage occurs. Have you ever experienced persistently itchy eyes for no apparent reason and simply dismissed it as inconsequential? Now consider the possibility that those itchy eyes might be indicating that your liver is in distress and your body can no longer effectively process toxins. This isn't merely a minor inconvenience. It's potentially a serious health issue developing silently. and if ignored too long, the consequences could be severe. What's particularly concerning is that itchy eyes might just be the beginning. If left unaddressed, liver problems can escalate rapidly, leading to more significant symptoms like extreme fatigue, unusually dark urine, and eventually jaundice. Your body provides these early warning signals to prevent further damage, but they're only effective if you're paying attention and take them seriously. Don't wait until these minor irritations develop into major health crises. If you're experiencing persistent eye itching, especially when accompanied by other symptoms like unusual tiredness or digestive issues, it's time to take action. Don't be among those who dismiss itchy eyes as trivial. In our busy lives, it's easy to overlook the subtle ways our bodies communicate with us, but those persistent itchy eyes might be conveying something far more significant than you realize. This could be your liver's desperate plea for help, begging you to address the root cause before it progresses to something more serious like cirrhosis. Your liver is an essential organ working tirelessly behind the scenes to keep you healthy every single day. When it begins to falter, it doesn't always send obvious distress signals. Instead, it communicates through quieter signs like itchy eyes, hoping you'll notice and respond appropriately. So the next time you experience that persistent itch, think beyond the surface symptoms. Ask yourself, could this be more than just minor irritation? Could it be signaling something more serious happening internally? Take care of your liver because it's constantly taking care of you, and don't ignore the warning signs when they appear. Early detection and intervention are crucial for maintaining liver health. If you suspect your liver might be struggling, whether due to persistent itchy eyes or other symptoms, prioritize seeing a healthcare provider. Being proactive is always preferable to waiting until the condition worsens and becomes more difficult to treat. 3. Itchy breasts, the warning sign you must never ignore. Beyond the itching sensation, inflammatory breast cancer typically presents with additional warning signs including redness across the breast, noticeable swelling, and a distinctive thickening of the skin that often resembles an orange peel texture. You might also experience unusual warmth or tenderness in the affected breast area. What's particularly alarming about this form of cancer is the rapid progression. Significant changes can occur within weeks or even days, making early detection and immediate treatment absolutely critical for improving survival outcomes. Why is this itching so significant as a warning sign? Unlike typical breast cancers that form detectable lumps, inflammatory breast cancer invades the lymphatic vessels within the skin, creating a constellation of visible symptoms, with itching often being one of the earliest indicators. Because this aggressive cancer advances so rapidly, the window for early detection is much narrower than with other breast cancer types. This means that by the time many women finally seek medical attention, the cancer has already spread to nearby lymph nodes or other body regions, making treatment significantly more challenging and the prognosis considerably more serious. Consider this scenario. You notice an itchy sensation in your breast, but dismiss it for weeks or even months as something insignificant, perhaps dry skin or a mild irritation from a new laundry detergent. By the time you realize the symptom isn't resolving, the cancer could already be advancing through your body. This is precisely why remaining vigilant about unusual body signals is crucial, especially when persistent itching in your breast has no obvious explanation. Don't wait for more serious symptoms to develop. By then, it might be too late to catch the disease in its earliest, most treatable stages. If you're experiencing persistent breast itching, it's essential to monitor for other changes occurring simultaneously. Inflammatory breast cancer rarely presents with itching alone. Look for additional warning signs that shouldn't be ignored. Watch for unusual redness, swelling, or a rash-like appearance on the breast tissue. The skin might develop a rough, pebbled texture resembling an orange peel, and you might notice small nodules or lumps forming beneath the skin surface. It's tempting to attribute these symptoms to benign skin conditions or lifestyle changes like diet modifications or new skincare products. However, when these symptoms appear together, and especially when they persist beyond a reasonable time frame, they could indicate early-stage inflammatory breast cancer requiring immediate medical attention. One particularly troubling aspect is that these symptoms typically intensify during nighttime hours. If you find yourself frequently waking to scratch your chest or experiencing discomfort that disrupts your sleep patterns, This could strongly suggest that something isn't right with your breast health. Another critical symptom to monitor is swelling in the lymph nodes, particularly those under your arms or around your collarbone region. If these areas feel tender, enlarged, or unusually sensitive, seek medical evaluation immediately. Swollen lymph nodes often indicate that cancer cells have spread beyond the breast tissue, requiring prompt and aggressive treatment intervention. The moment you notice persistent breast itching accompanied by any of the symptoms described, taking immediate action is crucial. Don't delay or assume the problem will resolve naturally. Schedule a comprehensive evaluation with your healthcare provider without hesitation. Early detection remains the key to effectively treating inflammatory breast cancer. The sooner you receive a diagnosis, the better your chances for successful treatment outcomes. Your doctor will likely perform imaging tests such as mammography or ultrasound to thoroughly examine your breast tissue and determine whether additional testing, like a biopsy, is necessary. While confronting the possibility of cancer can be frightening, ignoring the symptoms won't make them disappear. Delaying medical attention only gives the disease more opportunity to advance. Acting quickly could mean the difference between detecting cancer early when treatment options are most effective, or facing a more challenging journey if the cancer has already progressed significantly. We often overlook or minimize subtle signals our bodies send, especially when symptoms seem minor or easily explained away. However, persistent breast itching with no clear cause should never be dismissed. Your body has remarkable ways of alerting you when something is wrong, and it's your responsibility to listen attentively to these signals. Don't allow a seemingly minor symptom to go unchecked when it could represent your body's attempt to warn you about a serious underlying condition. As we age, our bodies often communicate through subtle hints that something requires attention. Even if you're not experiencing the severe symptoms typically associated with cancer, persistent itchy breasts always warrant careful monitoring and medical evaluation. Beyond recognizing specific symptoms, preventative care and vigilance are your strongest allies in protecting your health. Regular medical checkups, mammograms, and self-examinations are essential components for early breast cancer detection. Don't wait until something feels wrong before seeking medical guidance. Routine screenings can identify cancer before symptoms even appear, significantly improving your chances for complete recovery. If you're still engaged with this important information and finding it valuable, please comment 3 below to let me know you're still with me. Your health is your most precious asset, requiring constant attention and care. No matter how minor a symptom might seem, if it persists without improvement, it always deserves professional evaluation. While breast itching might appear insignificant, it could signal something far more serious. By taking a proactive approach to your health, you can identify potential problems early, receive necessary treatment promptly, and continue enjoying a long, healthy life. As we conclude this vital discussion, it's clear that even seemingly insignificant symptoms like persistent itching can sometimes indicate serious underlying health conditions. Your health is your most valuable asset, and paying attention to these subtle signals could make all the difference in detecting dangerous diseases early when treatment is most effective. What's your main takeaway from this information? Share in the comments below one insight you've gained and how you plan to implement it in your life, whether by being more attentive to your body's signals or seeking medical advice for unusual symptoms. Your experiences and perspectives could help others on their health journey as well. If you found this information helpful, please leave a comment, give this video a thumbs up, and don't forget to subscribe to our channel for more content empowering you to take control of your health. Your support means everything to us. Thank you for your attention, and remember, your body is constantly communicating with you. Never stop listening to what it's trying to tell you.